We are still learning more daily about the new variant, but no matter the cause, cases and hospitalizations, they continue to rise. We're joined this evening live on the air by Dr. Brian Kaminski. Dr. Kaminski with ProMedica and a partner of the V Project. He has joined us before. Glad to have him back here again. Doctor, let's start off talking about what our viewers need to know about Omicron, this variant.
Sure. The first important thing to say is there's a lot that we don't know, and so I wouldn't rush too quickly into making assumptions about this variant. We know that it's different. It is the most heavily mutated variant that we've seen yet, so there is concern that potentially it's going to be more transmissible, and then of course the concern that we may not be protected by the vaccine or by having had COVID naturally and the immunity that comes with that. But again, those things remain to be seen. I would ask people to be patient, not to panic as this information comes out, because we'll get some good, solid answers on those things within the next couple of weeks.
Brian, let me ask you, Delta, is it as severe as we thought, or is it proving to be one of those things that I guess for those who are vaccinated, it's manageable?
Yeah, so the vaccine is highly effective against Delta. We know that no vaccines are 100% effective, but if you've been vaccinated, and especially if you've been boosted, your chances of getting really sick from Delta are extremely low. So we know that the hospitalization rate for vaccinated people is 10 times lower. The risk of death is even higher than, it's even more suppressed by receiving vaccination with the Delta variant. So the vaccine is really the best thing that you can do, and it is highly protective.
Dr. Brian Kaminski joining us here live on the air. Doctor, we had a member of our staff here took one of their kids in for something not COVID related the other day, went into an ER, waited 3 hours. Talk to us about the strain on our hospitals right now. What are we seeing locally?
Sure. So there's quite a few things going on right now that are creating that strain. COVID, as you mentioned, is one of the primary drivers, receiving a high volume of patients in our emergency departments, and then admitted patients in the hospital that are either concerned about COVID, have COVID, and require admission, or just those people who need to be tested and treated and sent back home. On top of that, there's a lot of other things that are coming in. So during the first wave of the pandemic, we saw a lot of illnesses that really were suppressed because of people, delaying treatment, having fear of coming into the healthcare system. Some of those things have been alleviated, and so now we're seeing that backlog of patients coming in for ordinary illnesses that present to the emergency department. And then on top of that, there's a nationwide staffing shortage. So we've all heard about the Great Resignation, and that applies to healthcare as well. So we don't have the number of nursing staff, ancillary staff, therapists, technicians, and those folks, those healthcare providers that we ordinarily rely on to provide care every day. So it's all those things coming together that are creating a significant strain on our healthcare system.
Dr. Kaminski, we've got about 20 seconds left. Are we close to the point of seeing elective surgeries being canceled again?
There's certainly discussions about that and other things. So that's on the table, as with everything else as it relates to surge planning. So we know that there are some facilities that have already done that, and there are others that are in those discussions right now. So certainly that's something that we would look to as a potential solution that's temporary, but we don't want to do that because many people who are scheduled to have procedures wouldn't consider them elective.
ProMedica and the V Project's Dr. Brian Kaminski joining us here. Thank you so much for your insight. We appreciate it as always.
All right. Thank you very much.
Good to see you. Also, there are a few vaccine clinics set up for this week. There's some listed right there on your screen right here, right now. You can get the vaccine or a booster shot. For more information, check out what we have posted right now on our website. That address, of course, WTOL.com.